Tonight.
It started with a sore throat that persisted for weeks.
I knew it was something abnormal growing in there.
An ABC 27 special presentation.
I was told that I would need to get my tonsil out.
I think she just looked at me and she said, "It's a tumor, isn't it?" And I said, "Yeah, that's what they found."
I definitely thought that it was cancer this time, this time it was, my life was going to be done.
Penn State Hershey Cancer Institute presents Head and Neck Cancer, a Matter of Facts. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Head and neck cancers account for 3 to 5% of all cancers in the United States. They're diagnosed more often among people over age 50. More than 52,000 men and women in the U.S. are expected to be diagnosed just this year with head and neck cancers. Tonight, specialists from Penn State Hershey Cancer Institute are in the ABC 27 call center to answer your questions. So just call the number on the bottom of the screen, or you can email. Just send it in to abc27.com for those questions. Head and neck surgeon Dr. Genevieve Andrews will answer your emails throughout tonight's show. And of course, all calls and all emails are confidential. We begin tonight, Deborah Pinkerton sharing one patient story. Deborah?
Thanks, Chuck. A York County woman thought she had a toothache. She was shocked to find out what was growing inside her mouth.
It has 100 pieces. Yep, see?
This is a perfect afternoon for Barb Marcio. Her granddaughters, 8-year-old Leanna and 5-year-old Lily, right by her side.
It goes in the wing. See, I'm right.
Yeah, you were right.
Barb treasures moments like this.
I'd say my life is devoted to my grandchildren, and I do like to spend a lot of time with them.
But for months, Barb had to devote her time to something far more important, her own life. It started with a toothache.
In December, I started having some problems with my teeth, and the dentist just wanted to do a whole lot of things to correct the teeth, and I didn't feel like it was quite necessary because the teeth were in the back further in the side of my mouth, so I just asked to have the teeth pulled.
So a dentist pulled her teeth, but Barb says the healing process took longer than expected.
So I just sort of watched it, and it started getting, I knew it was something abnormal growing in there, so.
I think you better go to the dentist, find out what's going on there.
She showed it to me, and I immediately thought, that doesn't look good. I looked up mouth cancer, and it looked exactly like what was in her mouth. So, I remember calling her saying, you need to go get that looked at right away, not to wait.
Barb and her husband saw an ear, nose, and throat specialist.
He took a piece of it out, did a biopsy. Biopsy came back negative. So he said, I'm going to set you up for outpatient surgery and remove more of the growth and do another biopsy of it, remove it, and do skin graft. He told my husband before the surgery was done that he could not do the skin graft because he knew the growth was into the bone.
I was shocked. I just couldn't believe it.
I definitely thought that it was cancer this time, this time it was, my life was going to be done. It was probably my time.
Barb was right. Biopsy results confirmed it was cancer.
My dad told me, so I immediately came home, and it just felt like someone just punched you in the gut. And just why my mom.
I knew she had cancer before, and she kept on saying, I don't think I'm going to make it. I think this is my time's up. I said, you don't talk like that. Just see what happened.
Barb survived cervical cancer when she was 29. Now, 29 years later, she had another battle to fight.
My mom is my best friend, not just my mom, so I'm very close to her. So I wasn't ready to lose my mom. You don't want to think the worst, but it comes to your mind when you hear cancer, and knowing that she had it before, and now she had it somewhere else, it was just very scary.
I cried for weeks, and then finally I told myself that, no, I don't think it is my time. I can pray, and I can have people pray for me, and we can have a miracle, We can have I can still have a second chance. So I convinced myself that through the power of prayer that there was going to be another miracle.
Barb's prayers were answered when she met with surgeon Dr. Genevieve Andrews.
So she had been biopsy proven to have squamous cell carcinoma of the right lower gum. This is actually where the tumor was sitting, and it had eroded downward into her jawbone. And she didn't have any other signs of tumor elsewhere.
Good news, the cancer could be treated with surgery, but it would be a tough surgery.
My job was to remove the tumor, and the plastic surgeon and I did a team approach where after I removed the tumor, he reconstructed her. I recommended to her that we do what we call a composite resection, where you remove a whole segment of the mandible, the jawbone. In addition, do a elective neck dissection where you remove the nodes most at risk on that side of the neck.
Then plastic surgeon Dr. Shane Johnson would reconstruct her jaw with a technique called free tissue transfer, or microsurgery.
Our surgery involves removing the fibula bone, which is the more narrow bone on the outer side, between here and here. We take that bone with some overlying skin and some of the surrounding muscle. We dissect it out of the leg on a single artery that feeds blood to that tissue and 1 or 2 veins that drain the blood back out of it. We reshape that bone like her jaw, and then we connect those blood vessels up under the microscope to blood vessels in her neck.
After we met with the doctors at Hershey and hearing the process of what she had to go through to get rid of the cancer, it was horrific. It was horrific.
I was devastated. I can't imagine, and I wasn't ready to give up. I prayed long and hard every day to get me through it and to have my family be able to deal with what they would go through.
So surgery was scheduled, a day Barb and her family remember vividly.
She didn't cry. She didn't cry enough when it went in there. Didn't even cry at all. Had a very good attitude. It was hard. I was scared. I said, I was scared I was going to lose my life. You know, I was way scared.
I just had a positive attitude because I wanted to be strong for everybody else. But I was strong. I didn't. I just went in with a positive attitude, knowing that, you know, that God was going to take care of me.
Once they took her in, you know, it was like, okay, now we have to go to the waiting area, and you wait.
It was rough. I know it was rough for me. They have a thing in the back that tells you when they're in surgery and when they're done. I bet I went down there every minute. I kept looking at that chart.
My mom's sister, Dory, was there for my dad and I, and she was a blessing to have because we would have never made it that day without her there.
It was a long day, 19 hours of waiting. Then they received some good news.
Everything went just as they planned. The flap seemed to do well, so it was relief. And then it was, when can we see her?
I remember waking up, throwing my arms up in the air. That's what I remember, just going, throwing my arms up in the air and looking up. And then the first thing I remember seeing was my husband, my daughter, and my sister by my side.
After spending a week in the hospital, Barb came home.
It was a rough recovery. When I came home with the trach and my feeding tube. My mouth was wired shut.
Part of our reconstruction is we want to keep her teeth aligned like they were before the surgery. So we want to keep her dental occlusion as it was. And to do that and to protect our reconstruction, as we put, we term as arch bars, but they're almost like braces on the teeth, and then we connect them together with rubber bands.
For weeks, this is how Barb communicated. 2 months later, the rubber bands came off.
I just burst into tears because I knew I could have a first drink. I knew I could finally drink something.
Pathology reports came back with a thumbs up.
I know with the power of prayer that my prayers were answered, because she said they removed 51 lymph nodes
and all kinds of tissues, and everyone came back negative, that there was no signs of any other cancer cells.
The best news of all.
She's a very brave woman, I'll tell you right now. Very brave.
It ultimately saved her life, and it's given her more time here with us, which I honor her for that, and she's my hero. She is my hero.
It's all overwhelming. It's so much. It's sometimes hard to take. Very overwhelming to know you have a second chance at life.
As you can see, Barb is very thankful the surgery went well. She did receive 30 treatments of radiation to make sure the cancer is gone for good. Back to you, Chuck.
Thank you, Deborah. I just talked to Barb and her family out in the lobby. She's doing fine. The attitude is great. It's just wonderful. And joining us now is Dr. David Goldenberg. I apologize, we stand here talking for 15 minutes and get your name messed up there. The Director of Head and Neck Surgical Oncology. Now, let's begin with the basics, Doctor. When we talk about head and neck cancers, what are they? What are we talking about?
Head and neck cancers are a group of cancers that originate in the moist lining of the mouth, the pharynx, which is the swallowing passage, the voice box, the nose, and the paranasal sinuses. There are also some head and neck cancers that originate on the skin or in the bones of the head and neck.
So, all right, now, do we know right off the bat, in layman's terms, what causes this type of cancer? Something we can understand there?
Well, the vast majority of head and neck cancers are caused by smoking, with or without alcohol. Patients who smoke are at a much higher risk for getting head and neck cancer. Patients who smoke and consume alcohol have a even greater risk of developing a head and neck cancer. There is an increasing group of younger patients who do not smoke or drink who have a subset of head and neck cancers that are caused by the human papillomavirus, the same virus that causes cervical cancer in women.
So there's something new to deal with there. What are we talk about signs in Barb's package there. What are some of the signs and symptoms someone of head and neck cancers?
Well, oftentimes head and neck cancers mimic something as benign as a cold or a sore throat or laryngitis, depending on where exactly they originate, whether it's in the swallowing passage, the mouth, or the throat. Anything that persists, whether it be a sore throat that just doesn't go away, or hoarseness that persists, or a sore in the mouth, these are signs that tell us that maybe something more ominous than just a benign cold or upper respiratory infection is happening.
And what do you do to diagnose this type of cancer? How are they diagnosed?
Well, head and neck cancer is diagnosed typically. The doctor will take a thorough history, asking the patient questions about his or her habits, specifically smoking, chewing tobacco, alcohol use. Then he will ask about symptoms, how long you've had them, how long have you been hoarse, how long have you had problems swallowing, how long does it feel like something's stuck in the throat. After that, the doctor will move on to a physical exam where he will check your entire head and neck region. He will feel inside your mouth, in the back of your tongue, in your neck to feel if there's any swollen glands. Typically then we'll use a small camera that goes in through the nose to check the back of the throat and the voice box. Once a diagnosis is suspected, we take a biopsy for definitive diagnosis.
A thorough procedure.
Absolutely.
We're going to take a break out here at the desk, and we're going to check in with Deborah Pinkerton in the ABC 27 call center. Deborah?
Thanks, Chuck. The phone lines have been very busy. We've been getting a wide range of questions from thyroid cancer to HPV infection to a lump in the neck to voice changes. The number to call is 717-346-3333 or email your questions to questions@abc27.com. Now, here to answer our viewer questions is Dr. Genevieve Andrews, head and neck surgeon surgeon at the Med Center. Thanks for being with us.
Sure.
This is the first question. I'm in my late 40s, and over the past 3 months, I've had frequent sore throats. My mother did have thyroid cancer. Should I see a specialist? What are the chances of me getting this type of cancer?
Sore throat is not typically associated with thyroid cancer. However, it can be associated with other types of cancers if it persists for a long period of time. For instance, throat cancer.
And what are the chances of this patient getting thyroid cancer?
She is at increased risk for getting thyroid cancer given that her mother had thyroid cancer. I would recommend that she see her primary care doctor on an annual basis to have her neck examined for this.
Okay, thanks so much, Dr. Andrews, and we will be right back.